This video is going to be covering psychological disorders. In this video, we're going to be covering some of the highlighted disorders detailed in Chapter 14. First, let's start with what are psychological disorders? And if I had to sum it up in my own words, I would say that psychological disorders are an imbalance either in the mind or in the emotions that cause somebody to deviate from what is socially seen as acceptable behavior. Let's start with anxiety disorders. Anxiety itself are feelings of fear or worry so great that they distract somebody from their everyday life and activities. Anxiety disorders are additional ailments stemming from anxiety, such as phobias, obsessive-compulsive disorder, and narcissism. In researching for this project, I was surprised to see just how many people suffer from anxiety disorders and how well people are able to hide what they're suffering from. In the next slide, I've included a video of a man who's suffering from severe phobia of dogs.
Oh, hell no.
Hey, Marvin, stay with me.
This pit bull puppy comes on a corner. My heart, almost jumped out of my body.
Stay with me. Stay with me. You're okay. Stay with me. Let's do this together. You're good. You're in control. If you're backing up, you're running from your fear. We'll let the dog get closer to you, but I don't want you to back up. This dog represents 40 years of being in pain. So can I let the dog come closer?
A little bit.
Okay. Hey, you tell her when to stop. I'm gonna let you tell her. Okay. All right. Good. You're good. Do not look away from the dog, okay? Go ahead and come a little bit closer. You're all right. Okay. Think of your family who is not gonna want you to suffer. I think you should pet the dog.
See, no, she's looking at me. No.
Marvin, come on, Marvin.
Ooh.
Think of your girls.
Like anxiety disorders, depressive disorders also wreak havoc on the mind and the nerves, but are not limited to just that. They also affect the body, the emotions, and in my opinion, the spirit as a whole. Illnesses that can manifest themselves as a result of clinical depression can include bipolar disorder and postpartum depression. In my experience, I actually have a story relating to postpartum depression. I work at a hospital, and a few months ago I was assigned to care for a postpartum depression patient. At the time, she didn't really seem greatly different from any other patient that I've cared for, but in talking to her and in interacting with her, I did notice that there were sudden changes in her mood. She was depressed, she was erratic, she had borderline suicidal thoughts, and midway through my shift, I found myself shocked at how somebody who had just given birth can show such severe signs of psychosis. She stayed on my floor for about a week pending a psychiatric evaluation, which she did pass. But in talking to my coworkers, I found out how common, this disorder is, and how, although common, shouldn't be something taken lightly. It should be considered very, very serious. My next slide includes a video of a group of women discussing how common postpartum depression is and how to seek treatment if you find yourself suffering from this disorder.
Are afraid to talk about. I'm actually one of them. A lot of people don't know this, but I too struggled with postpartum depression, and I really appreciated that she talked about, the degrees of postpartum, because a lot of the times, I know me, I thought postpartum was just that you wanted to harm yourself or you wanted to harm your child, and I didn't feel that at all. I felt like I had this dark cloud above my head constantly that just wouldn't uplift itself. But thank God for you guys. Make sure you have an amazing support system. Thank God for my husband, my family, and my friends. And what helped me get through it is I just got out. I got out, I did some research, and also, ladies, moms, realize that it's a lot more common than you think.
Yes.
It doesn't mean you're weak if you have postpartum depression.
Right. Yeah.
You're actually stronger once you identify it and get the help you need.
Personality disorders are a deeply ingrained pattern of specific behavior that typically manifest themselves in the adolescence of a person. They make it hard for them to interact in social situations once they've grown to adulthood. Some common illnesses that can relate to personality issues can include multiple personality disorder, antisocial personality disorder, and borderline personality disorder. What all three of these disorders have in common is that they make it hard for the person suffering from this ailment to interact socially with other human beings, whether it be struggling with multiple identities or not knowing how to properly carry yourself in public, or in the case of borderline personality disorder, having a distorted view of yourself and a distorted view of how you should treat others, for example, in a relationship. Another personal story, I was assigned to sit for a suicidal patient who tried to kill themselves, and he was also suffering from multiple personality disorder. So firsthand, this is a very serious illness that people suffer from. It's very scary to, honestly, I was scared. The dude was really erratic, and he claimed that he had two personalities, switching from one back and forth. I had to sit for him for 12 hours. Being that he was a suicidal patient, I had to be on my guard at all times. And in little small talk, I really did notice what he was suffering from. It was obvious to see that he was dealing with something, and that he really did act one way and then totally switch to another personality. And it was a crazy experience, but it really showed me that all these illnesses are real. Although we're learning about them, and although we don't really relate to them personally, there are people out there that their lives are consumed by these disorders, and it's not until you really experience it firsthand that you notice how serious they are and what an epidemic our society is under, having to deal with these. My next slide contains a video that's very similar to how the patient I was sitting for was acting. So it's Charles Manson, and he's displaying severe sociopathic traits and behavior. So this is just a little idea of what my story was about.
People look at you today, 20 years later, and they still have no idea what you're about. Tell me in a sentence who you are.
Nobody. I'm nobody. I'm a tramp, a bum, a hobo. I'm a boxcar and a jug of wine. And a straight razor if you get too close to me.
I'm going to end this project with an interview that I did with a coworker who is currently suffering from clinical depression. For privacy purposes, she wanted to keep her identity secret, so I am not going to be including the video. I'm just going to be including the audio. It was done podcast style, so the quality isn't too great, so you'll have to forgive me for that, but I appreciate you for watching this video. Thank you for taking your time. Thank you. Okay, so I'm sitting here with Jocelyn. Thank you for taking the time out of your day to let me conduct this interview. So you've been open and honest with me about you struggling with depression, and I have a couple of questions for you, so let's just jump right into it. When did you realize you were suffering from depression?
I realized that I was suffering from depression in high school. I want to say I was about 15. I think honestly I've struggled with it for a very long time. Even when I was younger, I didn't really feel right. Mm-hmm. Certain things would kind of change the way my emotions.
Right.
But in high school is when at 15, I kind of realized like something's not right. I don't feel right.
Right.
Right. When did you feel it necessary for you to seek treatment?
I've honestly kept it in all my high school years. I recently seek treatment. I used to work at a psychiatrist's office. So just seeing how it was conducted, I didn't want to be another progress note in somebody's chart. I just didn't think my voice would be heard. I didn't think people would understand. So I kept it in for a very long time.
Right.
I honestly seek treatment by a doctor, my PCP, in 2016. So only 2 years ago did I finally start saying, I can't do this. But I've been feeling this way for many years and just holding it on and just dealing with it day by day on the inside.
How would you say that this has affected your life, depression, before you seeked treatment, and how has your life been affected by the treatment that you've received?
Well, prior, like I said before, I didn't feel normal. I always felt uncomfortable, very anxious. It brought on a lot of anxiety. Social atmospheres, I didn't feel comfortable. I would kind of seclude myself, and I just didn't feel normal. I felt awkward, and I would just try to stay away. And I believe after I spoke to my doctor and kind of let out how I felt, it felt kind of like a relief. I felt human. I felt like I'm not the only person who deals with this. So being able to tell somebody and get some advice and just know that this is something that many people deal with, I kind of just took a lot of weight off of my shoulder as far as being able to kind of just admit to myself and to someone else that, look, I need help.
After you've received that help, how have you seen that positive from that?
Well, it's positive because, again, I've distinguished that there's something that's not right, and I want to seek help. So I guess admitting it was the first thing for myself. Being able to talk to a provider about my life and my struggles, and having somebody from the outside point of view be able to give me their advice and their tips on how to handle things. I think it's very helpful to know that someone else is listening and someone else can help you try to turn things around, like they care to listen. So I just think being able to voice your thoughts, your worries, your anxieties, how you feel, it's healthy.
Right.
And I think just being able to talk to someone about it is what I think mostly helped me, to be honest.
In this day and age, with so many people suffering from mental disorders, psychological illnesses, we see an epidemic with prescription medication and substance abuse. Have you taken any of those medications, or have you found that just being verbal with your healthcare provider has been sufficient?
That's funny that you bring that up, because that's something I struggle with. I've been able to talk to my provider, and I have been prescribed medication, and reluctantly I have not taken anything. I do have my days where I struggle a lot, but I still don't. I don't want to be on medication. That's just my thoughts on it. They don't really push me for it, but they do, talk about the benefits of maybe a chemical imbalance if you're still not feeling well. But I just think that for me in my situation, being able to talk to somebody, write things down, meditate, try to just bring myself back to like reality is kind of working for me better than just taking medication at this point. I just, that's not something I really want to do.
Right.
So I just, again, being able to talk to somebody, having a therapy session every week, 2 times a week, even being able to write in a journal, because you could always write down at the moment how you're feeling, and then talk to the provider when you see them, and then kind of go through your emotions with them and break everything down. So I think it just helps, because again, the person you're talking to, if you're comfortable with them and you know that they're there to help you, and they have this background of schooling to kind of really get to the nitty-gritty of what's going on with you, it's mind-blowing, because I don't understand my thoughts sometimes, but when someone can break things down, it really opens your eyes to see things from a different point of view.
Right. And finally, in doing this project, I was really surprised to see just how many people, suffer from psychological disorders. How do you think we as a society view people that suffer from mental illnesses?
That's kind of tough. I know there's a lot of like commercials out there and advertisements and whatnot. I don't know too much about everyone else, but I feel like it needs to be brought up a little bit more. I think it needs to be taken a little bit more serious, because not everybody knows what people are going through on the inside. The mind is a very heavy thing. Just a little example, when I was at work, trying to see if I could go on leave, just not really feeling like I could do it. My insurance through my job didn't really certify me because they're like, well, you can't prove that what you're feeling is stopping you from working. So I just think that I don't think it's really taken serious because it's not something visible. You can't see that I'm hurting on the inside. You can't see that I have anxiety. You can't see that my heart is palpitating, super, super fast because I'm uncomfortable where I'm at.
Right.
So I think it's unfortunate that many people have to hold it on the inside, have to suffer, have to go on their daily basis trying to be normal and don't really seek the help because it's almost like they feel like they have to prove that they're ill or prove that something doesn't feel right because it's not visible. So I just wish that there was more empathy and more understanding that it's really something that is inside the brain and inside of the body that if it's not treated, it starts to show on the outside. But I just feel like it needs to be taken more serious.
Right. Well, I'm happy to see that you're on the road to recovery and that the issues that you were facing, early in your life aren't, such a big